I wasn't leaving. I was just. Okay, we are ready to begin. Okay, this is a meeting of the Health and Long-Term Care Subcommittee of the House Health and Government Operations Committee. I apologize for the delay in our getting started. We're going to begin with House Bill 354, Maryland Pathway to Nursing Program and Advisory Committee Establishment. It's cross-file House Bill 354 and Senate Bill 718. We will begin. I don't know who is. I don't know. Not me. Could everyone mute themselves so we don't have this feedback? Thank you. And the Senate cross-file, Senate Bill 718 by Senator Lamb. Council?
Just to clarify, Senate Bill 718 was not designated as a cross-file because these bills came in a little bit differently, but they are going to be the same in the end.
Yes, thank you.
So, as introduced, House Bill 354 established the Maryland Pathway to Nursing Program in the Maryland Department of Health to provide practical and financial support to nursing students. The bill also establishes the Maryland Pathway to Nursing Advisory Committee to assist the Secretary of Health in the development and implementation of the program. The sponsor is submitting amendments that almost match it to Senate Bill 718. I'll get to that in a second. The amendments establish a pathway to nursing pilot program in MHEC rather than in MDH, alters the goals of the program, requires the Secretary of Higher Education in consultation with the advisory committee to determine funding to support the program, strikes a requirement that the Secretary adopt regulations to carry out the program, requires the Secretary to issue grants to at least 2 pilot sites on or before July 1st, 2025, alters the membership of the advisory committee, requires reporting for 5 years, and strikes a requirement that the advisory committee complete a study on funding for apprenticeship programs. The reason I say that these aren't identical, I also circulated an amendment for Senate Bill 718. So the 2 amendments together would make these bills identical. The amendments for Senate Bill 718 add a representative of the Department of Labor to the advisory committee and also make a technical correction on the bill. And I'll note these bills do both have a high fiscal note, which we still have to get approval from appropriations on before voting in full committee.
Is there discussion about the amendments? May I ask council, are the relevant parties in agreement on the bill as it would be amended on the 2 bills?
I believe so, and Delegate Cullison is here. She's the sponsor of the House bill.
Delegate Cullison, can you comment on that, please?
Sure. Thank you, Mr. Chair. Yes,
Sure.
all the relevant parties are in agreement and are very excited about the program. With regard to the fiscal note, what we want folks to understand is the fiscal note for FY25 is $85,000, and that's the staff needed to actually set up and run the advisory committee. The additional part of the fiscal note will only be incurred once the program is designed and whether or not it can be, how it can be implemented. So I think that's a forward-looking way of the fiscal note. And I was able to meet with the executive director of MHEC last week, who was very eager to take the program on, feels like it's going to add a lot of value, and already was beginning to think about ideas about how to support this work. So I think we are good to go with everyone.
Terrific. Is there a motion on the amendments?
Move the amendments.
This would be to the House bill first. Moved and seconded. Is there any further discussion? Hearing none, is there a motion on the bill as amended?
Second.
So moved and seconded. All those in favor say
Bill
aye.
as amended?
On the bill as amended.
Aye.
And is there anyone in opposition? Seeing none, the bill passes. The Senate cross-file. Well, the Senate Bill 718. Is there a motion on the amendments?
Move the amendments.
So moved and seconded. Is there anyone opposed? All those in favor of the amendment say aye.
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 Is there a motion on the bill as amended?
Move the bill.
Second.
So moved All those in favor say aye.
Aye.
Anyone opposed? Okay, it's unanimous on those two bills. Okay, on House Bill 1263 and Senate Bill 952,
Mr. Chair, may I?
I was going to get to you in just a second.
Okay.
I was going to praise you first. You should let me
Oh.
do that. Despite the valiant efforts of Vice Chair Cullison, we are not yet at a consensus. We're going to continue working on that and in this afternoon in between floor sessions. But Delegate Cullison, you are recognized to speak to the issue.
Thank you, Mr. Chair, and I'm sorry I interrupted you.
No problem.
I had a lengthy conversation this morning, and it became clear to me that the way that we have pulled language from a bill that we think will pass, but not necessarily will pass, the brilliant idea that Delegate White Holland had, if it doesn't have the context, if it doesn't have the definitions, then there are legal ramifications for whether or not the services can be provided relative to the confidentiality issue. So I am asking for a meeting this afternoon. Senator Hedelman, I see, I'm not sure if it's you or your staff who is here, but you'll be getting a message if you're here. You're going to be getting a message from my office asking for us to get together with the Delegate Pasteur, our counsel, Lisa Simpson, and representatives of the industry. And if there's someone else you want us to include, let us know so we can pull this together as quickly as possible. And yeah, this is a much more complicated issue than we had originally thought. So I just want to make sure that we're making the right policy and that we're actually going to help the people that we're trying to help here with our vulnerable seniors who are looking for the right place to get the services they need. So with that, I'd ask that we hold House Bill 1263 and Senate. We don't have the Senate bill here, but
no, it's on the agenda. It's on the agenda, so you can hold it.
We do have it.
Okay, then we can hold it. So thank you for working with us on this.
But our intention would be ideally to resolve matters at this meeting this afternoon and then meet most likely at this hour again tomorrow morning.
Right.
Right. Okay.
Thank you. Thank you, Mr. Chair.
Thank you, Madam Vice Chair. Okay. I'm going to raise a question. I didn't ask this ahead of time. Well, the remaining bills are all going to be treated the same way, or that's the intention? Council,
There's one exception. There's just
Okay.
one exception to that. All of the bills will be treated the same except for Senate Bill 243.
Is it possible to do that on a consent calendar, one vote on all the bills, or no?
I think so, Lindsay.
Yep. Yeah, that's fine.
You'll
Okay.
need to vote on the amendment to change the sunset from 3 to 5 years and then vote on the bills as amended.
Okay. So please explain what the bills would do and why a 5-year sunset is being proposed, will be proposed. Or maybe we should get the amendment before us. No. Go ahead and explain.
So all of these
Sorry.
bills are extending health occupations boards. The bills were originally extending them for 3 years. The amendment before you would be to extend them for 5 years. And the reason for that is because this committee raised a lot of questions about the length of time for that termination. And Marie Grant, who I don't think is here right now, suggested the 5 years in subcommittee last week and then in follow-up bill hearings on some of the bills that are on this agenda.
So motion to move the remainder of the calendar with bills ending in sunset extension as favorable.
With the exception of Senate Bill 243, I think it is. Right?
Yeah.
And separate 243 for further discussion.
Okay.
Yeah.
Second.
So what we're moving first is the amendment. I don't think that's quite how you put it, but that's your intention, isn't it?
Yes, that move the amendments and then move the remainder of the calendar with bills ending in sunset extension.
Second on the move.
Okay, is there any discussion? Seeing no discussion, all those in favor of the amendment to the bills as enumerated, say aye.
Aye.
Anyone opposed? Okay, on the one bill as amended, which will be taken as a vote for all of the bills with the one exception, all those in favor of the bill as amended, say aye.
Aye.
Aye,
Aye.
and is anyone opposed? Okay, Senate Bill 243 is still before us.
So Senate Bill 243 is for the Behavior Analyst Advisory Committee, which is an advisory committee that's part of the State Board of Professional Counselors and Therapists. The board has requested that its termination be extended to July 1st, 2026 in order to make the advisory committee's termination date consistent with the termination date for the board.
Okay. Any discussion?
There are no amendments.
Any discussion? Is there a motion on the bill?
Move the bill.
So moved. And second, all those in favor of the bill say aye.
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 Anyone opposed? The ayes have it. Okay,
Thank you.
we have
Move two.
concluded the work that is now before us, and everyone is aware, and you always are very responsive to the subject that we will reconvene once we reach an agreement on the assisted living program legislation. Is there a motion to adjourn?
Move
So
to
moved.
adjourn.
We are adjourned. Thank you very much.
Thank you.
Oh, Lord. Oh. Hello, Frank.
I hear you. Oh, Lordy.
Indeed, indeed. I'm sorry if I was tense at the end, but it was like, okay, I got to figure out what to do here.
No, and it's the right thing to do. And we want to get to I want to get it finished.